For the past 10 weeks, New South Wales had been enjoying relatively low case numbers, but they've been creeping up and today a dramatic rise.
804 new locally acquired cases.
It's a rise of 236 cases from yesterday.
21 at Omicron, taking the number of the new variants to 85.
The highest daily total since early October.
There's a very strong message here for the community, and that is COVID has not gone away.
With more than 200 cases now linked to the Newcastle Nightclub cluster and the revelation the super spreader may have broken isolation orders.
If that's the case, I've asked for health to refer that person as soon as possible to liquor and gaming or the police, probably the police.
And contact tracers are pinging a lot of locals. More than 1.9 million alerts have been issued on the New South Wales Service app.
And we are of the belief that Omicron transmission is accounting for our increased case numbers.
And with a reduced 5-month interval, the government's hoping more Australians will roll up for a third shot.
Those boosters are so important as we stare down Omicron.
It comes as the PM announced plans for an mRNA vaccine manufacturing plant in Melbourne, set to produce up to 100 million doses a year from 2024.
Is that what's in here, is it?
It's not doing fill and finish here. This is go to woe. This is the whole deal. This hasn't been done in any other country that wasn't doing it when the pandemic started.
Whether it's variants of coronavirus right now, pandemics of the future, treatment of cancer, treatment of rare diseases. This is a massive game changer.
Thank you, Julia.
But the increase in cases isn't affecting the rollback of restrictions in New South Wales, with mask requirements, density limits and most QR code check-ins all being scrapped from midnight tonight. From tomorrow, unvaccinated people can attend shops, gyms and hospitality.
Our government in New South Wales has led the country. We're not about to start backflipping on issues that we promised the community will do.
We have decided as a country to live with this virus, and Australians have worked so hard to ensure that we can.
So as the pandemic continues to throw curveballs, are we right to go full steam ahead?
We're not going to let Omicron take us back.
Well, for his expert thoughts, infectious diseases physician Professor Peter Collignon joins us now. Peter, we're all looking at the calendar. We're staring down the barrel of Christmas. Are we going to have to wrap ourselves up in cotton wool if we want to avoid getting pinged and spending the whole thing in isolation?
Well, I don't think so. It's a question of how many people should be pinged and how many people should be isolated. But we're in the best position we're likely to be for quite a while. We've got high levels of double vaccination, 90% plus in New South Wales. Summer is coming, so there's less transmission. But more importantly, because of the high levels of vaccination, we see less complications from COVID, less hospitalisations, less deaths. The people who mainly get into trouble are the unvaccinated, particularly those who are older. So most of those things are behind us. The current vaccine, it's mainly Delta that's spreading, and we know it works quite well for at least 6 months. And even for Omicron, in South Africa and in England, where there's more Omicron, they're not seeing lots of vaccinated people in hospital, nor are they seeing unvaccinated people with that strain more seriously ill. So we need to be careful, we need more information. But so far, this is not unexpected. When England dropped all their restrictions in July, which was their summer, they saw an increase in cases that went down and then went up again, but they didn't see a big increase in hospitalisations or in deaths, even though they had much less hospitalisation than we did, 70%, and even though we've got much better climate and I think much better housing. So we should be in a much better position than what England was when they did this 6 months ago.
Peter, with all that being said, this is the question we really don't want to ask, but should we be pumping the brakes on easing restrictions?
Well, I think there was an agreement with the community as to what we should do. And all the evidence is if you've got very high levels of vaccination, you won't get a lot of hospitalisations or deaths. Yes, you might get mild infection, but perversely, if you're already double vaccinated and get a mild infection, it may give you longer immunity than even you get a booster. So far, unless we see a lot of increase in hospitalisation, in particularly people who are immunised, and I think that's unlikely, I think we need to still be cautious. You know, don't meet with anybody who's sick, keep crowds down at your own home, you know, have a barbecue outside, etc. All those things we can do practically ourselves. But I think we do have to live with this, and we're in the best position we're going to be. This is going to continue for years. So this is what living with COVID is. Protect yourself as best you can, but you've got to go along with life as much as is reasonable and is practicable.
Professor, Captain COVID here. Just want to ask a question on behalf of those who have had COVID. There's been lots of different advice, it seems, when people have just had COVID, when they should get their booster shot. When is the right time for somebody who has had COVID? When should they then get their booster?
Well, I don't think we know the answer to that yet. What we do know is if somebody is double vaccinated and has a COVID, particularly a mild infection, they have better immunity than people that got the booster. Now, I'm suggesting you should do that, but that also means we need to really wait for more data from the US and Europe, where there's a lot more COVID and they're in winter, and we'll be able to answer that question, I would think, next March or April, which is when the majority of people in their 30s and 40s would be 5 or 6 months after their second injection and when they're due for their booster. So we'll have information to answer that question better in a few months' time.
Well, Peter, thanks so much for your time.
Thank you.